Yes. Let's see if you can go ahead.
Situate it on my listen and ask everybody to start
Paying attention. Okay. Uh, what was the assignment that mom had gave you? How many phones do you have?
Oh, to do it in your computer. Maybe what you were telling me, put the phone there. I came and put the phone.
Yeah. Have you taken a phone? Okay. Yes. So what was the assignment about?
Mode of ventilator, parameters.
Mode of,
Ventilator.
okay, and parameters. So tell me.
Modes, assist controllers, and SIMB, synchronized intermediate mandatory ventilation. Assist mode means actively controlled by the machine.
Go ahead.
Assist control mode. In this, patient fully supported with the mechanical ventilator, fully depend on mechanical ventilator, either by volume or pressure assisted control and volume assisted control. The next SIMD mode, synchronized intermittent mandatory ventilator. Patient will breathe but supported with the ventilator.
Mm-hmm.
And next, non-invasive, like NIV non-invasive ventilator. This is after weaned from the ventilator, we have to put in non-invasive ventilator. It's depend on the patient's condition. Still, they have breathing difficulty means we have a non-invasive ventilator.
So which instrument are you going to use for the non-invasive?
Non-invasive, we can use mask.
As an example of a non-invasive ventilator, yes, what else? Anything?
CPAP, BiPAP. For COPD case, we use BiPAP machines and IPAP like that.
Okay. Why did Lampard ask you to do that as an assignment?
I have to
No. Oh, I thought maybe you gave her a wrong answer and she wanted you to find out more about the question. This is why I asked. Anyways, you don't forget that because she's going to come back for that. Okay. Now, with that so said, you are going in tomorrow, right? How mentally prepared are you? How mentally prepared are you?
Better than last time.
Better than last time. So what changed?
The fear will be less.
Okay, don't tell me will be. We are nurses. We do not use will be for something that you are not working on. You have not arrived tomorrow. You don't know if you'll be afraid or not. I need you to tell me what has changed actively from the day of last time and you now. What has changed?
I learned more.
You learned more? Yes.
Especially ma'am told me we have to identify the problem of the patient, then I like that.
Now, it is not just about identifying the problem of the patient. It's identifying the problem. It's not just about getting the signs and symptoms of the patient plus the disease condition, which is a history of the patient, but you identify the history will be given to you, the signs and symptoms will be given to you, the presenting signs and symptoms will be given to you. You must be able to correlate the signs, the presenting signs and symptoms with the disease condition and be able to use that information to diagnose what is happening now. What is happening now might be a complication of one of them. It said loss of consciousness, sweating, confusion, and they gave you a history of DM. You have gotten the signs and symptoms, you have gotten the history, you will know that this is hypoglycemia. Are you understanding? So you are using the presenting signs and symptoms plus the history, you join them together to get a complication. And when you get a complication, you are now going to solve depending on the complication. It is either an emergency that needs you to call, or it is something that you can start working on it and evaluating and then calling if in the long run it persists. Is that understood? So I guess the small runaround should have made you more comfortable for the assessment. And now what do I say? When you start your assessment or when you are given a question, I'm expecting you to do this. Because you are not going to be writing on the board, you are going to be using this small paper. You are either going to put it this way or you are going to put it this way. However, I prefer you putting it this way, so it will be longer enough. And you start by taking the question. You take the question on all the presenting signs and symptoms on one side, and on the other side, you present the case as best as you think is going to ease your understanding. Or you just take your two pen, you draw a line, and you use only this part, and then you use the other part after the questioning. Always ask for 2 minutes or 3 minutes to assess and to understand the scenario before you start. Is that understood? So behind you, you have a pen, draw the board into two, and I will give you a question, and then you can start from there. Oh. Draw a ball into two good halves. In the middle, habibi. Okay, so let's start. You can all be taking down the note and you can all do the assessment the same way. And please, those that are in class, the question 2 is for you. You take down the question, you draw a paper in two. On one side, you are going to be listing the scenario, and on the other side, you are going to be solving the scenario. I will be coming to class to check what you did or how you are intending to solve that scenario. Is that okay? Okay, so let's start the question. We have a female patient which is 67 years of age, diagnosed with hypertension, DM type 2, DM2, DM type 2. Give me on my table, Jackie, on my table, open the, you see a price list on top of it. Blue. No, not the drawer. The calendar. Open the calendar. Lift up the calendar. You see a monthly calendar. Have you seen the monthly calendar?
Maybe this magnetic?
No. There is a printed monthly calendar that is clipped with a price list. Yes. Give me that one.
After that, I need time with that.
Hold on 1 minute. My attention is needed.
I don't want to forget. You will still be playing some time, right? So I just need to know that you remember. Okay? So, you may put everything. Play number. Just fill in starting of your meditation. In the end of your meditation. You're now done with this person. Okay. So, what are the 5 moments of hygiene? So when hand washing is indicated, so when how long is hand washing? Hand wrap. Of course, you know the TPEs, right? Even I don't ask you, I ask you what is the purpose. The thing is, how will you put on the TPE? What's the first thing you ask? Before gown. Yeah, before gown, what do you do? Okay. Okay. What is going on with you?
Just wait there. So wants me to give one partition something for me, and I'm struggling to say. Sorry. My attention is needed.
The rest of their days. If you're looking at anyway,
Papa. Okay. Please dish yourself from some back. It's not, you were asked to remove it because it's not stationary. It has, for them, in general, it's 450. No, the one that we remove, he cannot walk. For us, he cannot walk. Because the daily rate depends on the number of days per month and the number of costs for that nurse. Yes, because for each nurse is different. It depends, it changes per month, per nurse, depending on the number of months. So it's not stationary, that is why you cannot control it. It's a crazy side. There are a lot of things to consider. First, a daily rate for a 24 son is different from a daily rate for a bridge. Jackie? All right, let's keep going. Let's keep going. You don't have a. Excuse me. You don't have this. You don't have flip cards. You don't have.
Yes.
I handed flip cards to you guys the other day.
Mine I have.
No, I'm asking.
I have.
You have.
Yes.
Oh God, you somebody's looking for me. You want to be killed by me? Okay, I'm sorry for the distraction. I was needed in the office then. We have a 67 years old female with history of hypertension, DM2, chronic back pain.
It's complaining.
Yeah, this is medical history. Chronic back pain. Okay, and the patient is having contractors, PEG, urinary catheter, the patient is bed bound, conscious but not oriented. The patient is bed bound, conscious but not oriented. The medication for this patient, we have Lexis.
Lexus?
Lexis.
Lasix.
Yes,
Lexus is the car.
happy to. 40 milligrams taken once daily. Amlodipine, ibuprofen. Ibuprofen 200 milligrams every 6 hours for pain. Ibuprofen.
Ibuprofen.
No, he's on amlodipine. Amlodipine 10 milligrams. OD. Ibuprofen 200 milligrams every 6 hours for pain. When you came into the patient's room,
Ibuprofen 300.
200 every 6 hours for pain. So this is the background that you should know, or this is the background that you need to know. Now the question starts. When you came into the patient's room, you realize that the patient has pitting edema on both legs. She has slightly shortness of breath. When you check the patient's fridge, you realize that the patient has insulin that is labeled and another set of insulin that is not labeled.
Listen, where's the... Let's see which one the two girls that told me.
Over the past 25 days, the patient's BP, no, the patient's blood sugar, over the past 25 days, the patient's blood sugar has been increasing above 7 millimole. Towards the evening hours. Vitals for this patient now. We have blood BP 120 on 70. Respiratory rate. Before, when the difficulties of breathing came in, we were having 20. So go up. Slightly difficulties in breathing, you put 20. Now you put respiratory rate 22. Temperature 37.9, 37.9. Oxygen saturation 89. Okay. Sorry.
Heart rate.
You can put anything you want to put there. I'm giving you the one I want to give. Now you are the nurse in charge. Remember where you came in? You came in when and you assess the patient. So this is your scenario. The first thing that I will want you to do, you are going to solve the problem, but we are going to be working alongside with you to make sure that you do it the right way. Okay? Then we will give you another question where you are going to do it by yourself, and I'll be expecting that you do it the right way. So let's start on the other second part. The second part, we are trying to segregate, we are trying to divide all this information into a usable information that we would want. Okay? And according to how I showed you on your splitting, how you are supposed to split, what is the first thing you should write on top of your splitting chart? Tell me before you write it. According to the last time that I taught you guys about splitting, what is the first thing you should be writing?
You prioritize the
You take priorities,
Yes.
and what is the first thing you will be writing? No. No. This little cupcake was not there. On the priority, after you have taken your questions on one side, and you are now going to the second side, the first thing is that the history will be given to you with a present signs and symptoms. Are you understanding? There will be a history and a present signs and symptoms. So we need to segregate the history from that present signs and symptoms. So the first thing I need you to see up there is that you will go there and write medical diagnosis or history. On the other side, you say medical history. And you jot 3 lines or 4 depending on the medical history you are seeing. Strokes. Take the first stroke, yes, and then the second. DM2, the third.
Don't forget
Okay. Now, the first thing you have done is you are taking the history. And because you've written that history like that, it is going to give you the chance to link all the signs and symptoms to the different disease conditions that you are, to the different disease condition that the patient is suffering from. From there, you go to the second step. What do you do for the second step? No, the second step, what do you do? You'll be checking at the contractors that the patient has. Because the first thing you guys are going to do is you're going to do everything and forget that the patient is having a catheter. Are you getting? So you indicate the contractors that we are having for the patient. The patient is having what and what?
Pectube and catheter.
And the urinary catheter. So you go down, you put corn.
Highlight them with different colors so that you see. Use
Yes,
a different
use
color.
a different color on that side. Thank you very much. So,
Yes, come in. Jackie?
it's just one. I was seeing 2 nurses
Sorry.
sitting here. 42 days. Why 42 days? So has approved. No, they will approve. Why 42 days? 44 days. Jackie, is Muhammad abroad? Yes. Okay. That he brought you himself. He doesn't want you to argue.
Yalla, Gracie, what did you write in red now?
Contraction, pectube and urinary.
Peg tube and urinary catheter. Okay, what's next now?
Yes, sir.
Next, signs and symptoms.
Signs and symptoms. What is now your major complaint of your patient? What is wrong with your patient now?
Pitting edema on both legs.
Spitting edema, highlight it, draw a line under it. Underline.
This is your anomaly.
Yes. What else?
Shortness of breath.
Okay, can you do a link between pitting edema and shortness of breath?
For hypertension, pitting edema on both legs.
Okay, a hypertensive patient might have pitting edema. Why?
Because
How hypertension would lead to pitting bilateral lower extremity edema?
fluid collection,
How fluid collection is done due to hypertension? Increase blood pressure.
increase blood.
So here to answer this question, you have to go back to the assignment of Shamsa. What is the pathophysiology of blood pressure or hypertension? And what are the causing factors of hypertension? And see if there is any link between the pathophysiology of hypertension and the pitting edema that you have.
Hi, baby. Duty calls. I have to be in the office now. Okay? Love you. Please.
Thank you, Aisha.
For this hypertension, now I have to.
Okay, now forget about the disease condition. Try to link the pitting edema to the shortness of breath. The two ones that you highlighted in red. And how those two symptoms can be connected. Symptoms. I'm talking about symptoms, don't look at the conditions. Shortness of breath and pitting edema. What does that give you as a hypothesis? What could be the problem?
Fluid overload.
Fluid overload, where?
Fluid overload in the lungs.
In the lungs. So if there is fluid fluid accumulation in the lungs, you will have pitting edema.
Yes.
Did you understand my question? Patient has lung edema, you are saying, right? Pulmonary edema because there is fluid accumulation in the lung. Does that mean patient will have lower lung edema? Due to lung edema? So what is the link between the two symptoms that you are handling? There is pulmonary edema definitely, but what else?
Other than CKD,
What is CKD?
chronic kidney disease.
Does the patient have CKD? Type move. What is another symptom that you can highlight?
This both only.
What's next? Can you read the scenario again?
67 years female, history of hypertension, type 2 diabetes mellitus, chronic back pain, contraction pective, urinary catheter. She is bedbound and conscious, not oriented. Medication Lasix 40 mg once daily.
So why the patient is taking Lasix?
Diuretics.
It is a diuretic, correct, to drain water out of the body. So why she's taking it?
Because of BP. For BP also we have to.
So there is something that is retaining water inside the patient's body that would lead to high blood pressure, right? Something retains fluid in the body, equal, automatic, will happen high blood pressure, correct? Type. That's why to drain water outside we are giving Lasix. What is this problem that is accumulating the water inside the body? What could be the problem? Kidney problem?
Due to hypertension.
How does hypertension lead to fluid accumulation in the body?
Oh, wow.
I cannot understand. Take a deep breath or explain.
Vasoconstriction.
Vasoconstriction lead to body fluid accumulation. Try to find the link. If you need help of Shamsa, ask her. I will put water in my cup and come back. Discuss together and try to find the proper answer.
Increased cardiac output, it causes the fluids inside the cells to move out from intracellular to extracellular, therefore accumulating in these extracellular fluids. But we don't know the cause of hypertension. If we knew the root cause of hypertension, that he is normally hypertensive, it's because he's taking steps. Okay, next, remember the patient has heating with if. Thank you.
If kidney obstruction emptiness, fluid accumulation will happen.
Blood. Now shouldn't you
Hypertension.
That is what we investigate. If we know the cause of hypertension, we would. Now the patient does not have CKD, the patient does not have any heart disease, okay? We only say hypertension and the patient is 67 years old, not too old to say that it's essential, okay? So if we don't know the reason for hypertension, we can say if there's increasing blood pressure, there's increasing cardiac output. This force pushes the fluid inside the veins, the cell of the veins, and not towards the extracellular place, causing fluid accumulation in the extravascular space. Okay? Then of course repeating edema.
But that vessels will be
If there's increase in the blood pressure, also cardiac output, if there's increased cardiac output, blood will pump out at a high pressure, forcing the intravascular fluid outside the veins where fluid is accumulated outside the veins. Therefore, causing
Done? You have the answer now? Yeah, well, tell me. Go ahead.
due to increased blood pressure,
Okay.
it will increase the cardiac output. Due to increased cardiac output,
How increased blood pressure will increase cardiac output?
that against blood flow against the artery wall,
Bravo.
it will pumps so fast, so the cardiac output will be also high. The cardiac muscle also pumping
More.
and the cardiac output also.
Type, repeat from the beginning. We have hypertension. Patient is diagnosed with hypertension. That would lead to
Cardiac output. Increased
increased cardiac output. And still this is not very convincing, but okay, next.
It will again the cardiac output is high, means the vessel will be the blood flow against the
Cardiac output is high, meaning what?
cardiac output means
Mm.
the pressure of the cardiac artery, blood flow to the artery is
We're talking inside the heart or in peripheral circulation? Systemic circulation or inside the heart?
systemic.
Circulation, okay.
It will
So the pressure that the blood flow is exerting on the wall of the vessel is high. This is what you want to say. Because of the higher cardiac output. Tayyib, okay, what's next?
it will
I'm not frowning, okay, I'm just focusing.
it will cause extracellular, it will push the fluid to extracellular, then the fluid accumulation is present in the extracellular.
Okay, بس نحن we need to understand how. I need the specification to go through the end result, which is edema. You need to convince me and tell me what will happen with the cardiac output in the vessels, in the extracellular, and the intracellular, so that I will see end result as edema. You understand? And shortness of breath. Why is there shortness of breath also? Okay? So, the bigger picture is okay. I want you to understand it more so that you can communicate it in an easier way for yourself. Anna, I understood what you said, but someone else might not understand it fully and consider that your answer is incomplete. Okay? So I want you to train on it so that you can give me complete, clear answer. Okay? Now let's repeat it one more time. Take a deep breath, repeat it one more time. Let's see how it's becoming better. Yeah.
Increased blood pressure will cause the vessels, the force against the blood vessels will be high, so the cardiac output, the pumping of the heart is so fast, so it will increase the cardiac output and increase in peripheral vascular system.
I'm not looking at you so that you speak easily.
Peripheral vascular system, and the fluid will be accumulated in the extracellular.
Why the fluid is pushed into the extracellular fluid, in extracellular space?
Because of the pressure of the artery. Increased pressure in the artery will push
what?
from intracellular to extracellular.
Why? To do what?
Constricts.
To do what? What is the purpose?
To expel out.
Why? Due to increased cardiac output and increased vascular resistance, increased BP, it will leads to if you keep the fluid inside the systematic circulation, blood pressure will remain high and will go even higher, and patient will go into crisis, hypertensive crisis. So patient body will try to compensate by removing those fluids from the systematic circulation to at least keep blood pressure in high elevated levels but not to reach the crisis. So they will push them into the lungs, into the legs, into somewhere to get rid of the extra fluids from inside the vessels. You understand? Okay. Now, again we go back to this patient. Patient is having pitting edema on both bilateral legs. Patient is having shortness of breath, and the insulin label is not
one
well
is
clear.
labeled, another is not labeled.
Okay, so how many problems now? This is the case that you have. What are the main points that you need to focus on when taking care of this patient?
First, pitting edema and shortness of breath.
So what you will do for pitting edema and shortness of breath? How you will analyze this, how you will assess, what you will assess in the patient, and how you will manage.
For pitting edema, I have to assess saturation level.
Saturation is how much?
It's 89.
So why you will assess again saturation?
Okay. Other than this,
This, you remove it and you add it to those symptoms because the three are on the same category. Shortness of breath, desaturation, and pitting edema. The three are signs of one condition. So which is? خلاص هذا الدرايد. Put the cover so that they don't dry.
For this fitting edema, I have to assess edema.
So, if you are going to draw contents of suction, put it in the when you flush, the one flush, only anything that you inside the feces, vomit, urine, so you flush even blood, right? So anyway, so that's the thing. Okay, my question is, what about soap linen that you need to draw? Yeah, but you need to throw away in the purplish.
Yalla Gracie, what you will assess in the patient? How you will manage this condition?
For ABC.
Don't talk, perform.
For shortness of breath, I will administer oxygen and position the patient.
Gracie, what are you doing?
First, I assess
What you will assess?
lungs, like breathing part.
Assess.
Inspection. In inspection, there is no asymmetrical breath. Visible lymph nodes nothing. Tracheal deviation is nothing. Then palpation. There is no abnormalities. Then percussion. In percussion, with sound.
What?
What sound?
What sound?
Crackles.
Crackles on resonance?
No,
Crackles on percussion?
no, resonances.
خلاص يا Gracie, يعني what is this? Sorry for what? Repeat. What you will hear upon percussion for this patient?
For this patient, resonance only.
Why you will hear resonance?
There is no fluid collection in the pleural cavity.
Wallah, this is a case of what?
Pulmonary edema.
Pulmonary edema. What will happen in
Excessive
pulmonary
fluid, excessive fluid only, it will pass fluid into the pleural cavity.
Mm.
So, if it excessive means it will hurt and dullness will be heard.
So you have to explain both cases. You don't say I will hear resonance only. Okay, continue. Auscultation.
Auscultation, I will auscultate.
What did you hear?
Crackles.
Where?
Crackles in this lower part.
Mm. Why?
Because of the fluid accumulation is most in the lower part.
Is it bilateral?
Yes, ma'am.
So you have to specify. I heard bilateral lower lobe crackle.
Then
So-
after auscultation,
You're very slow, by the way. Patient is dying. Saturation is 89.
then I have to assess for circulation. Breathing is over. For the meantime, we have to manage the patient. So administer oxygen. Before administer oxygen, capillary refilling. Have to press 5 seconds and count it to 2. The capillary is normal. Heart rate is normal. And BP also normal.
BP is normal.
Is 120 plus. Then I have to check for circulation by touching the tips to thigh. not warm. It's like
What kind of what is the stage of the pitting edema do you have?
stage 1, stage 2.
What is the stage that she gave you?
Pitting edema both.
So what you should assess? Which stage is the pitting edema? Right? What else?
Then the skin will be shiny, shiny and little warm like that.
What else you need to assess in edema?
Skin tone. That's it.
No, there's more.
Cellulitis is there. It's,
If there is cellulitis or no?
it's too warm means cellulitis.
Only to
Any-
one?
No, no. Any redness, any hard to press like that.
What else?
If I found the pitting edema means I have to manage with pillows by some elevate the lower limbs and
You will
position.
elevate the lower limbs, what will happen? Water will drain?
It will reduce. Water will be up, but not more.
I do not understand.
If I elevate means the water will be elevate to up now.
Yes.
So it will be go to the lungs?
Yes. 90, below 90. Yeah, just not
Where it will
because of
go?
the bill. Somebody will come out. That real one.
Where it will go?
I will be
It will
paid
go to
for
then,
something that to be
chest side.
So did you solve the problem?
You call in and come back to you.
So what is this
We have to
management?
administer Lasix tablet.
Can you administer Lasix? Once daily, medication is 40 milligram once daily. Can you give it? Once daily means at what time?
8 a.m.
8 a.m. What if we are now at 12 p.m.? If we are at 8 a.m. you can give. If we are at 12 p.m. what you will do? You will give another dose of the medication? So what you will do?
Then I will check for catheter site also.
Why you will check for catheter site?
Fluid accumulation. Fluid accumulation due to inappropriate drainage also will cause the
So check what you will check.
catheter site before that hand wash and wear gloves and the catheter and the urine bag will be in place without kinking and it's not touching.
How you will check kinking? How you will check if it's in place?
by looking,
Eh,
by looking and the bag will be placed in the below the bladder level
and
and
below level of the bladder and
do not touch the floor.
you always forget this. You are not allowed to say half of the sentence. Full sentence is below bladder level, not touching the floor. You should continue your sentence till the end. This is not the first time I hear this comment. Continue.
And the urine catheter and the tubing is not kink.
Tubing is not kink, catheter is not kink, okay. What else?
Then any obstruction is there.
Obstruction of what?
Obstruction in internal, like bladder.
Something you need to check inside this bag, down below.
Urine color,
Yes, it can.
urine color and amount of urine,
Mm.
drain. If it is in position, we have to check for urine drained or not. If it is obstructed means we have to use aseptic technique to push the catheter into little inside If it is not obstructed means urine will be came.
You know what you are showing me? You are showing me you're just memorizing what I am saying. I need you to know that you understand what you are saying. Not always you should push it inside and try to see if there is obstruction. And pushing it inside is not only because of obstruction. Because maybe I said the urine catheter is not in the bladder. Not only because of obstruction. So you are memorizing what I am saying and you come put them in a small sentence that shows that you don't understand what you are doing. If you answer this tomorrow, it shows that you don't know how to handle a catheter. Because you did not explain in a full sentence. You just said, I will push it inside with aseptic technique to see if there is obstruction. Excuse me? You see if there is obstruction by pushing it inside? Is this what I said? So you have two options. You either improve your English or and talk properly with a good sentence, or don't use half a sentence and memorize what I said and come and say half of it. This is not gonna help you. How many times I said lower the rail when you are working? How many times? Did you lower the rail? Did you increase the bed level on your waist level? Like, what is this? Yesterday we practiced this. And how we're improving? We're not improving. Why? Continue. Still, urine is not draining.
Patient is having DM.
Did you finish the fluid accumulation? Did you manage properly? Why you are confused, Gracie? You have highlighted this and you need to check it fast. Patient saturation is 89, you're not joking. Temperature is 37.9. You still did not go there. You are still on just accumulation of fluid and edema. He died already. Fast. Finish fast.
No, I have to evaluate.
Evaluate what? What did you manage to evaluate? What did you do? You are still in assessment, checking things. Did you conclude anything? Is this urine retention? Is this hypertensive crisis? What is this? What's the problem of your patient?
Pulmonary edema
Due to what?
due to fluid overload or accumulation. Due to hypertension.
So, it will be managed because we cannot manage that now.
How do you manage this?
First, positioning the patient.
خلاص, enough positioning of the patient. Position will not do anything. Move.
And administer oxygen.
Eh.
Administer oxygen and watch for patient if it settles.
How long?
For 15 minutes.
15 minutes you will wait. Saturation now is 70.
If improving means we have to wait for 15 minutes.
Such patient will improve?
No?
Such condition will improve on you administering only oxygen? So what you need to do?
We have to call 999. Call
Very early. Really, you identified that this is an emergency very early on time. Patient passed away already. Thank you. And still we did not handle other causes. We're still in one problem only. If I were you, I do not need to do inspection and palpation of the chest. I know what is the problem. I know what is the cause. I know what is the cause. I already prepared my scenario and I highlighted what is my problem and I did the link between shortness of breath, edema, SpO2 89 and hypertension. Correct? And plus I have urinary catheter. So it is crystal clear for me that I just need to percuss, auscultate and check urine catheter. Very fast. I finish, I go to the legs. I check edema and I see what is the status now. Obviously, this cannot be managed at home. It does not have to take more than 5 minutes, and 5 minutes is too much also. We've been now sitting for half an hour for this. Literally. For you to understand that you need to start with the assessment, then you started, then you needed to do C. Why are you going to check capillary refill? Your vitals are there. And if you want to do B and C and D, you have to be quick like this. Within seconds you have to do it. You cannot be that slow and do full assessment and you're still ignoring what are the important things to highlight in your assessment. It's not the time to check no tracheal deviation. It's clear that there will be no tracheal deviation. So why do I have to waste my time? Here your time is very critical. How much is your saturation? You heard the crackles in the lungs. Can you do anything inside the house? And you will wait for another 15 minutes to put oxygen and bye-bye. Another problem.
Insulin label and unlabeled. Unlabeled, we have to call for a medicine reconciliation for pharmacy or home care nurse to ask whether the medication is ordered by the doctor or changed by some.
Can you repeat, please?
For this,
Insulin label is not there. So what you do?
I have to call pharmacy and for medication reconsideration.
Medication reconciliation for a medication that is not labeled.
Yes.
Okay. So what you do?
And to confirm whether it is not prescribed or why there is no label in this insulin.
Mm.
And is this the medication is given to the patient or not? We have to consider.
Are you convinced with what you said? Are you convinced?
Yes, because if we are not,
So you will give it?
no, we are not giving. Just hold and ask this to pharmacy for medicine reconciliation.
So, but pharmacy answered you that this is not prescribed by the pharmacy.
Then I have to call for home care nurse.
What if the patient is not under home health care? What will doctor will do for you? You called pharmacy and told your patient does not have such a prescription. What you will do?
I'm not giving to patient.
Of course you're not giving to patient. Something else you need to do.
Report over.
Definitely you report to your team, which is us, and then you initiate over report. This is a medication error.
Ma'am, I have one doubt. I have one doubt. If they give these scenarios means directly we have to go and manage the patient.
This is what you understood from what we did now?
Before that we have to assess by you told like if shortness of breath means we have to assess for there is no need for inspection palpation. Directly we have to percuss and like this.
You only care about memorizing what I said.
Memorizing.
Bala Gracie, you only care about if I had this, I will do this. If I had this, I will do this. You don't want to use your brain. This is a scenario of a patient. Go ahead and handle your patient. How you will assess what is wrong with your patient and how you will manage. This is the question. This is what you need to show in competency. So here you are applying your assessment skills by choosing what and how you need to assess, where you need to assess and how, and showing the skills of assessment, and analyzing the assessment findings to know what is the problem and manage it. So you need assessment and management of any case that they will give you. So don't do tomorrow only percussion and auscultation because Patricia told me in this case yesterday like this. This is not okay. You should not memorize. Imagine you are in the hospital and you have a patient that you see his saturation is 89. What you will do? Are you going to do head to toe? Is it time now to do integumentary assessment? Move.
Blood sugar increased above 7 millimole towards evening hours. Increased. For this I have to administer medication like insulin which is labeled. Before that, I have to check the glucometer also, whether it is working properly. Any steps are changed like that. Any new steps are given to the given by the PNF, given by the pharmacy, it will error like that.
Everything is normal.
So we have to consult doctor, tell the patient, tell the doctors regarding last 25 days he is having this much of sugar. We have to reconsult. Review medications. Can be changed to another.
You want to change to another medication? What will be the other medication that you want to prescribe?
Like increase the dose.
I think I need a break. Take a break. I will come back.
She said 7. 7 is not there.
Bullshit. Where is this phone that is live? Where is the phone that is live? Remove it. Close it.
It's only in evening time it's more than baseline. I keep medication.
I see.
What were you saying about today?
It's better
result is normal.
Yes.
Yes. Or even
Because I think the patient has fever and his blood pressure and his blood sugar.